It doesn't mean that COVID's going away, but it does mean that we're shifting into a new phase. And it's this recognition that what has been in the front of our minds for so long is now sort of moving into the background, like so many other infectious disease threats that we need to be concerned about and impact policy and impact our health, but are not the front of our minds every day, every second. Absolutely, scientists will continue to work on COVID vaccines. We don't know in the future what new variants might emerge, and also there's room for improvement in existing vaccines. So there's two major areas that folks are working on. The first is in nasal coronavirus vaccines, and those are administered through the nose, and the idea is that they stimulate those antibodies in the nose, which is that first line of defense against the virus. Second area is universal coronavirus vaccines. This is a longer term goal. It will take longer to develop. But the basic idea is, can we have vaccines that are better equipped against future variants or even other types of coronaviruses? Policymakers and scientists are still working out exactly what the policy will be for COVID vaccines moving forward. We are definitely moving in a direction of something simple, using flu as a model, so something like an annual shot. But it will depend on some things. It will depend on what the seasonality of COVID looks like. We have a very clear flu vaccine season, but it's less clear for COVID what that will be in the future. And it will also depend on risk groups. Are you 65 and older? Are you immunocompromised? And what happens in the future? Are there new variants? There's still a lot of uncertainties. During the pandemic, I felt a real opportunity to teach and the importance of sort of explaining the fundamentals of infectious diseases, how we study vaccines, and there was real immense interest in understanding. And there are things that now terms people have heard of are not, herd immunity. There's things that people now are familiar with that they were never familiar with before. So there's been a real shift in the public consciousness and public awareness of these concepts that I think will benefit us in the future. I can think of two main things that we learned during this public health crisis. The first is what we can achieve with a lot of resources towards developing vaccines quickly with quick timelines, and also how well mRNA vaccines work. That will definitely benefit us in the future. And the second thing is the importance of social science research, not neglecting that from the beginning, understanding the behaviors that impact things like vaccine uptake, things like what types of policies work best, and really making sure we're supporting that research and science from the beginning.